Okay, sometimes what happens, this excess of galactose, which can be converted into galactitol by one enzyme which is called aldose reductase enzyme. Okay, so now we will be talking about galactosemia and the complete disorder. So galactosemia, first of all, it is an autosomal recessive disorder mainly seen in the infants, in which you can see there is complete absence of galactose 1-phosphate uridyl transferase in the classical form. Rarely there is a deficiency of galactokinase also. Okay, infant cannot utilize galactose of milk. Okay, so what are the biochemical features, so biochemical basis of the clinical features? So you should know, infant appears normal at birth, later on it will become a lethargic. Why it will become a lethargic, I have been discussing in a subsequent discussion. Galactose 1-phosphate can be converted into glucose 1-phosphate by one enzyme, that is galactose 1-phosphate uridyl transferase. But if this enzyme is deficient, what happens? There will be increased amount of galactose 1-phosphate in the blood, and there will be increased amount of galactose excretion in the urine. This condition is called as galactosemia and galactoseuria. First feature that can be seen. What happens when the blood galactose level is raised? It will induces insulin secretion, and you know, insulin going to down regulate the blood glucose levels, ultimately resulting in a hypoglycemia. And this hypoglycemia, because of this hypoglycemia, the child become lethargic, infant become lethargic. Ultimately, if the feeding is not given properly and the disorder is identified late, that can ultimately result into failure to thrive. It is very serious condition. You will be learning in your pediatric classes about failure to thrive. There are so many causes of failure to thrive. One common cause is inborn error of metabolism, okay, in which we are observing the galactosemia as a common condition. Due to blockage of above pathway, there is accumulation of galactose 1-phosphate. Okay, so the excess of galactose 1-phosphate is going to be converted into galactitol, okay, galactitol, which is an alcohol form. Okay, these two products, galactose 1-phosphate and galactitol, ultimately going to be deposited or accumulated in the liver, kidney and nervous system. If it is going to be deposited in the liver size will be increased, that is called hepatomegaly. Generalized amino acid urea can be seen. Jaundice, cirrhosis, if the ultimately liver is going to be affected, and if nervous tissues are affected, there is a severe mental retardation. Okay, this you should know. So excess of galactitol, there will be a conversion of increased galactose to excess of galactitol via this aldose reductase enzyme, and this is ultimately NAD plus dependent. Okay, so more amount of NADPH is going to be formed. Why? Because this enzyme is ultimately NADP plus dependent. Okay, so once this galactitol is ultimately accumulated in the lens, it will exert an osmotic effect, and once in the lens there is an osmotic effect, the lens will absorb more and more of water, and there will be osmotic changes. And once the lens absorb more and more water, there will be swelling of the lens. Subsequently, there is a opacification of lens, and there is a classical finding in this particular galactosemia case will be the oil drop cataract. Okay, you can see in your textbooks there will be a photo of oil drop cataract, how it will look like. I will simply draw it here like this. This is how there will be oil drop cataract on slit lamp examination. You can see. How will you diagnose? Early detection is a key feature to diagnose this particular disease. Why? Because measuring activity of galactose 1-phosphate uridyl transferase in the RBC is very important. Because if you are not treating it in a early condition, the child undergo repeated attack of hypoglycemia, and ultimately the hypoglycemia will result in the failure to thrive. Okay, you can use prenatal diagnostic techniques like amniocentesis for this, which is an invasive procedure, and urine galactose level or urine galactose by mucic acid test can be a diagnostic tool. So how will you treat the condition? You have to withdraw the lactose from the diet, because once mental retardation sets in, there will be no further improvement. Early detection is an important. Lactose free diet up to 4 years, you have to give lactose free diet up to 4 years. After that, this enzyme galactose 1 phosphate pyrophosphorylase becomes active. Okay, this will convert galactose 1 phosphate to UDP galactose. Okay, so this is very short topic and very easy topic. Why oil drop cataract is seen? These are the probable questions that can be asked. Why cataract is seen in galactosemia? Okay, why there is a hypoglycemia? These are the common questions that can be asked in your viva and your theory exam also. I hope this thing is very clear. If you have any doubt, just post in the comment section, and this will be conclusion of this particular topic. Just go through it. You can take a screenshot of the notes. Okay, thank you. You can just take the screenshot if you require this. Okay, yeah, thank you so much.